Dr. Sullivan, and I wanted to start out by telling you a little bit about myself. My background is actually as a physician assistant. So I started out as a PA. I went to school at Texas Tech University, and I graduated with my master's back in 2010. I then practiced as a PA for several years and went back to school to achieve my doctorate in functional medicine. So really what I do today is more natural medicine, and my goal is to help people figure out exactly what's causing their problem so that we can help them fix it. That's a little bit about my background and my education, but just to take that a step further, I like to share that I do have a couple kids at home. I have a son and, well, actually 2 sons and a daughter. My son's the oldest, and then my daughter and my youngest is 6 months. So it's a really exciting time for us, but really what I found in being a busy mom is that it's really important to me to make sure that I'm healthy, because now if I'm not healthy, it doesn't just affect me, it affects my husband and my family, even down to my patients. So, and maybe you see this in your own life, just that if you're not healthy, then it doesn't just affect you anymore. So really, where I like to go with this is just to say that in our nation today, we really have a health crisis. We have a health crisis in our care, and then we also have the health care crisis in our healthcare system. And so I like to break that down just to talk about the reasons why, because I find that if we can prevent those reasons, if we can reverse that from happening and do something different, then we can probably actually fix these problems and be able to help people have a different future, for not only their future, but for the future of our generations. So, and you'll probably agree with me on this, just that in our health care, I think that a lot of it has to do with our lifestyle. Our lifestyles are to blame. So sedentary lifestyles, the foods that we're consuming, genetically modified, processed foods, I think that a lot of it has to do with high stress and just the effects that this has on our body. So that's actually good news though, because that means that if we change our lifestyle, then we can change the future of our health. The second step is the healthcare crisis system, and I think that this really comes down to, in our healthcare system, pharmaceuticals, insurance companies. I think that a lot of our doctors' hands are tied just in that they can't really go through and fix the cause, because they're tied down by what the insurance systems will cover. And so I think that just to be upfront, I believe that our doctors really do care for the most part, and they want to help, but they're limited as well. Pharmaceutical companies sponsor the medical schools, so our doctors are taught what they want them to know. And so I think that the traditional medicine setting has a place, and I do believe that that place is more for acute crisis situations, not these chronic degenerative diseases. 70% of our diseases today are really lifestyle dependent. Diabetes, acid reflux, obesity, high cholesterol, high blood pressure, autoimmune diseases, the list just goes on. But when somebody has one of these health problems, where do they usually go? Go to their doctor, right? They use their insurance card and they look at what doctor is in their network, and then they go to that doctor. And what does that doctor really do for them? Gives them a medication, right? So my question is, does that medication, does that actually fix the underlying cause, or does it mask the symptom? It masks the symptom, right? And you know that because you weren't able to get off the medication. You had to stay on the medication, and if you stopped it, then the problem would come right back. Sometimes you have to be placed on more medications. So essentially what we're saying is that our insurance pays for a medication that's not even fixing the problem. Therefore, if we want different results, then we have to be ready to do something different. And that is going to involve stepping outside of that insurance system that we've become so comfortable with. So that doesn't mean turn your ears off right now, because we're not going to be able to help you. We work with a lot of people who are retired or on a fixed income. While insurance doesn't pay for the things that we do at Pure Wellness Center, the thing about it is that we still need to invest into our health. You know, I think that has a huge reason why we have a health crisis in our nation today, is because we're not investing into our health. You know, it's kind of like your auto insurance. Well, your auto insurance doesn't pay for you to get an oil change or your tires rotated, right? It doesn't pay for that maintenance on your car. It pays if you've been in an accident, then you can use it. And I think that is a little bit more along the lines of what our insurance should really be looked at. So what I'd like to do is talk to you a little bit about functional medicine, just in that what that really means. So it can be interchanged with alternative medicine, holistic medicine, natural medicine, and functional medicine is just really applying natural things to get the body to function better. So it's much like this wilting plant up here. You know, if you see a wilting plant, you think it needs water, right? Or sunlight, or nutrients. So you think, what is this plant missing that it needs? And then sometimes there might be something interfering with the plant. And that might be, you know, toxin or inflammation. And this is kind of like in our body, you know, something interfering with our body. So these are the two components that we look at. We look at if your body's not working properly, well, what is it missing? Or if your body's not working like it's supposed to, what's interfering with the body? And these are actually blood tests that we can do that help us determine the cause of what you're dealing with and why someone might have certain symptoms or conditions. Sadly, it's not really that way in our healthcare system, is it? You know, the healthcare system is not based on figuring out what's causing the problem and fixing it. And I'll actually share a story with you on something that happened in my own life. My mother was diagnosed with colon cancer. And so she went through chemotherapy and radiation and multiple surgeries, and she ended up passing away because those forms of treatment didn't fix her problem. They, in fact, made her sicker. And all too often I see this take place in that traditional medicine field, that we're not figuring out what's causing the problem. And that's really what has brought me to doing what I'm doing today, is that I really do care for people and I want to help them. I think that we deserve a better quality of life. All too often I see people work so hard their entire lives to retire, to get sick. You know, where now they're spending their time at the doctors, and they're spending their time and their money on being sick in the hospital, on medications. When, if we just invest into our health initially, we can not only have a better quality of life, but we can prevent all of that and those expenses in the future. And not to mention how that could affect our future generations and our kids and their kids, if we just learn how to be healthier. It's not hard. You know, does anybody know what the #1 used website is? It's WebMD. So it has a symptom tracker on there, right? So you can go in there and type in your symptoms, which is fine. You know, maybe you just wanted a label. I think that the problem comes into play when somebody goes to click that next tab that says, well, what medication do I take for this problem? You know, because people are going to their doctors today, really more than ever before, saying, I think I just need this drug. You know, but there's a lot of drug ads out there, and they have a lot of side effects. You know, I was listening to one, it was on bladder incontinence, and so it goes through and it lists the side effects, medications for bladder incontinence, and it's saying, well, the side effects could be diarrhea, you know, has been shown to cause sudden death. Who wants to be that statistic? But are these drug ads working? You know, and they are, but I think that the sad part is that they're teaching people how to think. because they're teaching us to think that if we just take a medication, then we'll be able to fix the problem, when in fact, we weren't meant to be on medications for the rest of our lives. We don't have diabetes in our nation because people have a lack of metformin in their system. No. For the most part, if somebody has diabetes, high blood pressure, high cholesterol, hypothyroidism, does not mean that you have to be on medication for the rest of your life, even though your doctor may have told you that. I very much work with your doctor, so it's not like I'm just going to stop your medications. I'll make sure that I am slowly titrating you off of your medications as we're seeing results. So there's a few myths out there. The first one is diabetes always gets worse, or diseases always gets worse. When in fact, the Centers for Disease Control actually state that diabetes in particularly is completely reversible. It's very much preventable. And while most diseases we may think of are genetic, genetics actually plays a role 5 to 10% of the time, and what plays a way bigger role is our lifestyle. So we can prevent most of these diseases that seem to run in our families. As far as the testing, I've heard doctors say, well, we did a panel, everything looks normal, everything looks great, just keep taking your medication. Really? And so if we just keep taking this medication, and just because the labs are showing normal, that's more of like a resetting of the light. If your service engine soon light comes on in your car, and you take it to your mechanic, your mechanic, let's say, well, he just resets the light. So then you go back the next day and your service engine soon light's back on again. How frustrating. But let's say we had to keep driving this car. We reset the light day after day. Eventually what happens to the car? Well, it breaks down, right? Well, so that kind of sounds like our healthcare system, doesn't it? People just resetting the light day after day, taking these medications, rechecking their blood sugar, thinking that everything looks normal, but yet the damage is still going on inside our body. So we really need to look at this a little bit differently. And the place to start is usually by listening to your body. Your body produces a lot of different symptoms saying that something's not working like it's supposed to. It can be things like tired, brain fog, or poor concentration, just that low energy. Things like mood swings, depression, anxiety, that nervous, emotional feeling. And let me just go back, because most of the time, depression and mood, those are based on your neurotransmitters. Well, serotonin is a neurotransmitter that's responsible for mood, but 99% of that is actually made in your gut, not your head. And so now that it's not just a problem that you're not producing enough. It might be that your body isn't absorbing it like it's supposed to. So we don't just need to be put on a medication. We need to figure out what's causing this. Gas, bloating, the digestive system. Most diseases start in the gut. And we need to listen to those symptoms, that bowel difficulty, whether it's trouble with diarrhea or constipation, insomnia, whether that's trouble falling asleep or staying asleep, muscle tenderness, spasms, joint stiffness and swelling. This can indicate inflammation, and inflammation is the cause of most of our chronic diseases today. So, and then we start to get into complications, neuropathy, that pins and needles. This is often a complication in diabetes. It is reversible. And if our symptoms go on for so long, we're diagnosed with a disease, we take a medication, we cover it up, push it off, then eventually these complications like a heart attack or a stroke take place. If you have diabetes, you have a 2 to 4 times increased risk of developing a heart attack or stroke, despite taking all those medications of lisinopril and simvastatin and metformin. Eye disease. The number one cause of eye disease leading to blindness is diabetes. Kidney failure. Number one cause of kidney failure, diabetes. Burden on the family. And then it becomes like, well, almost, what if I don't die? What if I get sick and my family is now suffering because they have to take care of me, or I can't take care of myself, or I can't, pay the bills anymore? So diseases start with symptoms, and many symptoms can start in the form of weight gain. Weight gain is really just a symptom of poor health. And that's why there's always those associated symptoms like that fatigue or insomnia or acid reflux, headaches, joint pains. And then from there, the disease starts to take place. So better to catch it early when there's only symptoms than to wait so long. And of course we can still help, but it's not going to be as successful as if we got it, right in the beginning. So there's a lot of different reasons for weight gain. Number one reason that I see is because of hormone imbalances. So looking up at this picture here, the first one is estrogen. So an estrogen imbalance is usually that weight gain in the hips, the lower tummy, the arms. So this is an imbalance in estrogen, and really what we need to do is figure out what's causing that problem and correct the hormone imbalance. Because estrogen is that fat storing hormone. It's kind of like a cellulite type fat. Doesn't matter how many crunches you do, it's not going to go away. Same thing with the adrenals, more of a belly fat, and until we really start to balance the adrenals and figure out what's causing that insufficiency, this weight gain doesn't really go away. These are your typical coffee drinkers. Wake up in the morning, you have to have a cup of coffee to get going. Have to have a cup of coffee in the afternoon to stay going. Usually the low energy, the poor sleep cycles, high stress lifestyles, this is the typical picture of somebody who's dealing with adrenal insufficiency. The next one up here is thyroid. So that's really a weight gain all over. And again, it's a hormonal imbalance in where we need to get the fat burning hormones to work more optimally. The last one up here is insulin resistance or liver. So anything that affects the liver. Insulin is a fat storing hormone. That's why if you see somebody who becomes a diabetic and starts on insulin, they automatically gain weight, and it's in their abdominal area. Now, what's important to understand is how all of these are connected. Okay, so typically for insulin resistance, we look at somebody and they have problems like fatigue, constant hunger, those cravings for sweets, that fatigue especially after meals, the migrating aches and pains. But what's more is on the other side, if this isn't corrected, other hormone imbalances start to take place. So then you have that estrogen dominance, you have cholesterol problems, thyroid problems now. And so all of these imbalances are really connected. If somebody has diabetes, we need to look at their adrenals and how those are working, because the adrenals function directly with the blood sugar metabolism. So it's really important to have all of those components. And then what's more is if the diabetes continues and progresses, a lot of times we start to see cognitive problems. They're talking about a diabetes type 3, where the cognitive function is now impaired because the blood sugars are crossing over the blood-brain barrier. So cognitive impairment is when a person has trouble remembering, finding words, learning new things, concentrating, or making decisions that affect their everyday life. And it can be mild to severe. Now, if somebody has cognitive impairment, they have a 38% increased risk of developing dementia. Dementia is an epidemic in our country today. And so it's very important that we figure out what is leading to this epidemic. And a lot of times it starts with that mild cognitive impairment and these inflammatory conditions, which start as simple symptoms. So that's why we have to be willing to take that step. You may have been told that your labs are normal, but you still have symptoms. And really the reason why I see that happening is because these lab value ranges that the FDA puts together, they're oftentimes based on bell curves. So now what a bell curve says is that 95% have to be within a normal range. 95% of Americans are healthy right now? No, I don't think so. So what we do in functional medicine is we take a more optimal lab range. So we bring it in. Now anything outside of here is really considered a yellow light. I'll give you an example. If you've had your alkaline phosphatase tested, the lab value range is between 35 and 115. Now in functional medicine, we bring it in. So I like to see a range closer to 70 and 100, or right in between there. And in that way, if it is outside of there but not quite out of range, then we can focus on fixing it, rather than, I don't want to wait and just check it again and wait for it to go out of range. I'd rather figure out what's causing the problem now. So it's really important to have the proper test to figure out, okay, if these are your symptoms, what's causing the problem? Is it an autoimmune problem? Is it a toxicity, a gastrointestinal problem? Is it a thyroid condition, an adrenal problem? And then from there, we can start to correct it. Now, with these conditions, like I said, we have to have the proper test. So in traditional medicine, they don't really do a lot of testing. I mean, they do their blood tests, but they're so routine. They're just looking at what the problem is. They're not looking at what caused it. And so that's what I was talking about originally about when I showed the picture of the wilting plant, in that we can look at the testing. We can look at, okay, what is causing the inflammation, maybe certain foods, looking at what is causing nutrient malabsorption and what nutrients the body's not absorbing. And then same thing with hormones. We do saliva testing to figure out over a 24-hour period, how are those hormones changing? And we can do, 4 different saliva tests in one day rather than, just a one-time blood test that might look like it's normal, but not be in the evening, but we wouldn't have known because we didn't test right. So I think that testing is really important, and we really want to figure out what's causing the problem. At Puro Wellness Center, really what we do is we do the test, we take you through these steps to fix it, and then we educate you and teach you how to maintain these results. So it's really a very comprehensive program, just in that we have all of these aspects, and this is where I find that people are most successful, is when they go through a full program. But of course, we're obviously willing to help in whatever area that we can. In fact, I think that we really do need to do something different, because even the World Health Organization recognizes this. They say that 90% of all diseases prevalent today are not treatable with orthodox medical procedures. So they're pretty much saying that, the medications aren't fixing the problem. We know this. And so if you want different health, you have to be willing to do something different. And I hope that you're ready to take a step of action, because I would love to be able to help you. And I know that it's not hard. It's just different. And it's just making sure that we're taking steps in that direction. And then eventually it will start to become habit, and it will be a healthy habit. We have to be willing to step outside of our insurance systems, because look, Medicare, this was taken off of Medicare's website. A treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition, is not considered to be medically necessary, and therefore we don't pay for it. Really? I don't understand. They're pretty much saying that they're not going to pay for something that works. And I have a lot of people question that. And I don't have the answers, but I guess what I can say is that insurance, it's designed to actually keep you sick, right? Because they don't make money if you're healthy. They make more money if you're sick. I'm going to have somebody share their story with you, and then we'll move on.
I had high blood pressure, chronic joint pain all the time, really high cholesterol. My weight, I was rapidly gaining all the time. I have a psoriasis like rash all over my face, and I wish I could show you a picture like how good this looks now, because I was so uncomfortable having my picture taken at that time. As you bed, and then something would happen when I would lay down in bed that I was wide awake, and I would be wide awake all night, and it would start over again. I was too tired to get things accomplished. I had, sorry fellas, monthly pain that was so bad, it would bring like a grown man to his knees crying. It was so bad. I would miss out on work. My immune system, I would guess, was functioning at the time at like 30%. I had, in the course of 1 year, strep throat 6 times. I was sick with a fever or a flu or stomach problems probably twice a month, and it's very hard to keep a job because no boss is that understanding, and then you are stressed out, and the stress doesn't help either. It was about this time last year, my hair was starting to pull out, and I kept going to doctors, and they kept saying, everything's fine, but everything was not fine. I was telling my boyfriend Eric that I just wish someone, instead of trying to shove a bunch of medications in my face, would actually listen and try and cure the symptom instead of trying to cover me up with a bunch of Band-Aids. And he heard Dr. Sullivan's advertising on the radio for a dinner like this, and we went to go check it out, and I immediately signed up and I started the program, and since then I have no mood swings or depression. My face is cleared up. I have not been sick once this year, and all my coworkers are sick all the time. What else? I don't have asthma problems anymore, so that's good, and I very rarely have pain that keeps me from leaving the house. So my life has done a complete 180, and it was the best thing that I've ever done.
So that was Gab's testimonial, and you can see she's really come a long way. I mean, she had a wide variety of different conditions that she was dealing with, and we were able to help her address all of those. And I really believe that the reason why is because those were all connected. And once we figured out the cause, then everything was connected. So really the steps that we take are, as what I was saying, we start with making sure that we have the proper test to figure out the cause. And then once we figure out what's causing the problem, we really want to focus on fixing that and actually correcting the dysfunction. Not just altering the lab value with the medication. We do use supplements, but they're really just meant to be on for a short period of time. I don't think that any supplement needs to be on for, somebody needs to be on a supplement forever. Now, really the steps that we take is addressing the body as a whole. Rather than giving you 3 different medications for 3 different problems, most of the time they're all connected. And if we figure out that connection and fix it, we can resolve all of those problems. So we take a very step-by-step approach, a systemic approach with mentoring, with that education, that guidance, because I really find that, there's a lot of books out there, there's a lot of good articles, good things to read, good research, but here's the thing, it's kind of confusing. It's not individualized. Until you actually sit down with somebody who's going to mentor and teach you as the individual, you'll never know what your body needs. For example, in one book you can read, eat eggs, they're good for you, right? They're high in protein. No. Don't eat eggs. They're bad for you. They're high in cholesterol. Well, both of those statements are true, but the problem comes in when, you don't know what your body needs. So that's really where we come into play. It's by doing the tests that help us determine what your body needs and then teaching that to you. Now, there's a structure that our program follows, and from there it's individualized. So we start with a detox, and for most of these components are really what's absolutely necessary to correct any of these health problems that I've been talking about tonight. And it only makes sense, right? Because if we detox, if we cleanse and get the body to start healing, then we can provide the body with the nutrition that it needs, and make sure that the body's, once free of inflammation, now able to absorb those. So the detox, it's not scary, it's not hard, it's not going to be, have you running to the bathroom, it's not a fast, okay, you're still eating. It's just targeting your own detox organs, utilizing supplements and homeopathics. And then with the nutrition component, we have a nutritionist on staff, and she has a certification in functional nutrition as well as a registered dietitian. But you know, she's much different than the traditional functional or the traditional nutritionists, because they still follow that sad American diet, that standard American diet that led to many of the diseases that we're dealing with today. So the next step, once we help teach you how to get the nutrients that your body needs on a more individual level, is exercise. Now we do have a personal trainer, but most of the time he provides the members with education. So teaches you how to do certain exercises that are going to help you get the results that you're looking for in your health, and really focus on that overall support. The next step is hormones. Now, many times hormones are imbalanced, and this is what led to the diseases that we're dealing with in the first place. So we make sure that we do the proper tests, as I was talking about earlier, saliva testing, to teach you how to balance those hormones. And then from there, we are able to fix those problems. Sometimes we use supplements, but none of our supplements are any sort of hormone replacement therapy. The last step is the nervous system. So just really supporting the overall cognitive function so that this becomes a very comprehensive approach, and we're able to prevent diseases by taking this approach. So you can see it has each of these components in the right order, at the right time, with that education, and with that testing. And this is really the reason why I find that our programs are so successful, is because all of these components are included. You know, whereas one person may have seen a nutritionist, they may have done something here or there, and they get improvements for a little while, but then it comes right back. You know, there's a lot of diet plans out there, Nutrisystem, MetaFast, Weight Watchers, and I hope that you understand the differences, because by no means are we a weight loss program. We are a health program, a lifestyle program, and by improving your health and your lifestyle, you lose weight. So it's almost a side effect of getting healthier. But I think, again, what's important to understand is how those programs work and why we're different, so that you can understand that they're not going to work for you. I mean, 90% of people who go through one of those programs, what do? They gain it right back, right? And 75% gain more. Well, here's why. Because they're teaching you to cut your calories. So cutting your calories, what does that do to your metabolism? It slows it down. And then it's no wonder why we start to gain the weight right back, because we have to go back to eating that normal caloric intake diet. So we never tell people to eat less. You know, most of the time we're telling you need to eat more. We just need to focus on what we're eating and figure that out. So ask yourself these questions. Think about what brought you to watching this. How would life be if I were able to resolve my health issues? How has my life been affected? My relationships, my ability to work, my ability to enjoy life. And on a scale of 1 to 10, how motivated am I to really take care of my problem? It's kind of a big one, right? You know, all too often I see people, they really tend to put their health on the back burner. And I think that we need to be willing to put our health as a priority. There's always stuff going on in our lives. That's not going to change. But it will make our life that much better if we now do something different and recognize that our health is very important, and it really is our greatest asset. So the next step that you would take from here would be to come out and visit with me, okay? I'll put together a program that I think is going to be beneficial to you based on what your health concerns are and what goals you're trying to meet. It's not hard, okay? It's just different. We make it something fitting for you. We want you to be successful. Of course, doing something is going to be better than doing nothing. What's hard is sitting on your couch, you know, being afraid to go to the doctors because you don't know what medication they're going to give you next. Here's the other thing. You can be somebody who's very healthy, just really wanting to take that preventative approach all the way up to, I mean, I've seen people on 15, 20 medications and they're just really struggling and don't know what to do next. They have multiple doctors and like I said, we'll work with you. And of course, anybody in between. I've seen all kinds of rare conditions. I've worked with pretty much most people, just in that it comes back to figuring out the cause and having the proper test to do that. We really do strive to make this very much affordable. So while insurance doesn't cover this, we've been able to work with a lot of people who are on a fixed income or retired. We can usually work the budget around $150 a month. So that can be with financing, but the thing is that everything's included. So everything that I see that you need throughout your entire program is included. Now, our programs are can be different time frames, they can be different lengths. You know, you can be coming in here a few times a month. We work with a lot of people from an off-site location, but what I'd like to do is share one more story with you and then I'll close.
This is Mr. and Mrs. Udell, Dawn and Ronald, and they started the program about 3 months ago, is that right?
Oh,
Okay, very good. And Ron, why did you originally come to us?
yeah. To get healthier, I really help doctors.
Yeah. And you had diabetes.
Basically, she made me dumb. Sure, you.
Yeah.
Diabetes.
Yeah.
The reason why I made him come was because I caught him with a half gallon of ice cream eating from it. And I basically ran upstairs and he came up later and I said to him, you love food more than you love me.
Oh.
And if you really loved me, you wouldn't be doing this to yourself. So I saw your ad in the paper and I suggested that he come here because I wanted my husband to be around for a long time.
Yeah.
And that's wonderful. And you've done the program with them.
Yes, I have.
So I'll start with a free dinner.
And Ron, you were taking insulin. How much insulin were you taking?
I was taking 18 units of,
Thanks.
how do you do? Lantus in the morning and evening, and then Novolog at every meal.
Okay. Yeah. And you're completely off of your insulin?
Usually I'm all my insulin.
That's
And
wonderful.
blood sugars have been fine ever since probably the third or fourth week I
That's
started.
wonderful. And you were taking some blood pressure medication as well?
Yes.
And you're off of that?
Yeah.
Yeah.
And since I've lost a little weight and got healthier, I don't take my water pills.
Yeah. Or your cholesterol medication.
No, I don't take the cholesterol medication.
And you've lost some weight, and your family's noticed as well, right?
They sure have.
And the aches and pains have gone away.
Oh, yes. And you were in pain almost every morning,
Yeah, when I wake up.
and you haven't had any pain.
Wake up pains, my hands hurt. I just, we just start to move around for the first hour or two.
And you haven't had any pain at all.
No.
That's wonderful. And then Dawn's done the program with you, and she's been having quite a bit of improvement as well
Yes.
with weight. You've lost some weight.
I've lost some weight. I've been off one blood pressure medication.
That's wonderful.
Cut down on my estrogen. And I'm continuing to lose weight.
That's excellent. Well, thank you so much. I just want to congratulate you for being such great patients and having so much improvement.
Well, thank you for taking care.
Yes, thank you.
You're welcome.
For saving my husband.
You're welcome. Thank you.
Now, I like to tell people that our programs are designed to help people figure out what's causing their health problem, take them through the steps to fix it, and then ultimately teach you and educate you how to be able to maintain those results long term. So it's not just a quick fix, but that maintenance and that preventative approach is there. So do you think that the program helped you?
Well, I think it helped me tremendously, and it still does. Actually, this week I was reading some of the stuff in the book.
So you did a program, it was 4 years ago, and was able to come up with insulin as well as lose over 50 pounds. And the best thing about that is you maintained it. So
Yeah,
that's wonderful.
yeah.
Well, thank you
And
so
it's
much.
something you have to work on.
see, I mean, that's really our goal with anybody who goes through our program, is to not just have that quick fix, but to teach them that maintenance so that year after year they can continue to be off of their medications and live a healthy lifestyle. So what I'd really like to invite you back to is to come back to Puro Wellness Center and Spa. Puro means pure in Italian, and my mother was Italian, so that's where I got that from. But what we'll do is we'll sit down and we'll have a consultation, okay? It'll be a complete wellness evaluation. You'll have a new patient packet to fill out prior to coming in. You can either print that right off of our website under the Forms tab, or we can mail one to you. I do ask that you fill it out prior to coming in because it is pretty detailed. It might take 30-45 minutes to fill out. Bring that with any labs that you have done, any testing that you've had done in the past 6 to 12 months. And then I also do require that you bring your spouse too. So, or significant other, you know, it's really for your benefit. I've been doing this for a long time now, and our goal at this evaluation is to help you move forward with a program that is going to fit your needs, your lifestyle, financially, and we discuss all of that. So in order for you to meet the goal of moving forward with a program, I find that it's important to have whoever helps you make those decisions with you. It just works out much better than going home and trying to tell that person everything that I said, because it doesn't always match up. So please, I do require that you bring your spouse with you. Has anybody ever, well, I guess I should ask, we're much different than when you go to your doctor, because when you go to your doctor in that traditional medicine setting, you know, the nurse brings you back and the doctor comes in eventually. I mean, the doctor statistically in our nation spends about 7 minutes with their patients. And that's just really not enough time, you know, and then you usually leave with a prescription. And you're billed sometimes $250, $300, $400. You know, you may think you're copay, but that's really what the doctor billed. And it's just, if that isn't getting you help, you know, in other words, maybe you've been with your doctor 10, 15 years. Again, I'm not bashing your doctor, but if you're still dealing with those health problems, you're still on medications, then that doctor's not helping you fix the problem. And that's what we're going to do, and that's really how we're different. Because the number one reason for senior citizen bankruptcy is medical debt. And that's really what I'm trying to help people, is reverse the need for those medicines, and really just fix the problem. Now, what I'd like to do is set aside an hour of my time with you. So for that time, I usually charge $250 for that initial consultation. However, for watching this, I will be taking a $200 off. So that means that it's only $50. So if you call right now, the number is 734-716-5588. We'll be able to get you on the schedule with myself. We do have some limited initial consult times, but once you get into the program, we can very much work with that full-time schedule. We can work with people who are, you know, need weekends or evening hours, and then we'll be able to make sure that we get you the help that you need. We'll figure out a program that's going to best benefit you. So I really hope that this information makes sense to you. I hope that you can see that I'm really passionate about what I do, and I really do enjoy helping people overcome their illnesses. So I look forward to meeting with you. Just a couple more pieces of information here. We are located right in Belleville, right downtown. It's a really cute little spot. We also have a spa. We're located right on the lake. So our spa is all natural, chemical free. It's just a really great way to de-stress. Now, Einstein said this: the definition of insanity is doing the same thing over and over and expecting a different result. So I really hope that you're ready to make some changes, and I would love to be the one to help you. So again, call us, schedule an appointment with me. I have a few other testimonies I'm going to share with you, and then I'll see you in the office.
I've been a diabetic for 15 years. My concern is my weight and getting off my insulin.
My health was scaring me to death. I had a fever neuropathy things. I had, doctors weren't giving me good answers. I knew I was eating improperly, but every time I would try to make changes, I wasn't getting any response to losing weight.
I have a serious problem with my knees, inflammation, my arthritis. And my doctors actually said, Teresa, you need to have double knee replacement surgery, which shocked me. And also I was dealing with being overweight.
When I came to Pearl in September, I had been very ill for several months and was bedridden most of the time with pain, fibromyalgia, migraine headaches, neuralgia in my face, many things wrong that kept me homebound, kept me from doing tasks, kept me from doing things I like to do.
The biggest was frustration over not being able to lose weight, so I felt like I had tried a lot of different approaches and I hadn't really helped. I also had an injury to my knee, so that was making it harder to walk. I just felt like, you know, I was on blood pressure medication and thyroid medication and just having like swelling in my legs. And I felt like I was getting older than I was.
One of the main reasons I did this Puro is to take my health to the next level. I felt that I was stagnant.
I was suffering from migraine headaches on a regular basis. I was having trouble losing weight. I felt nauseous most of the time and just didn't feel good when I did eat. Even though I was kind of even starving myself to lose weight, it didn't do any good. I couldn't sleep. I couldn't fall asleep. I couldn't stay asleep.
Like everything that she would say that was me, you know. When you go to a doctor, you got high blood pressure, what do? Well, they tell you to take another pill or take a higher amount of the pill. Every time I went, I was getting more and more pills, and my bills were getting more and more.
And I had been on medication for diabetes and trying to watch diet things.
Well, when you came to us, you had a hemoglobin A1C of 9.6 or 9.8.
And it had been higher than that. It had been, I think I even went over 11.
Because the doctor was going to put me on oral agents for diabetes and considering having taken some.
Well, I mean, I remember you saying that the traditional medical doctors couldn't really do much for you at that time.
I would go to church, I had to quit teaching Bible studies. I couldn't have lunch with friends anymore. My life was home.
I mean, I've been on medication for that for many years, but it just felt like the dose just kept going.
When you started, your blood sugars were pretty elevated. You were on insulin, right? Well, were you on any medications before that you no longer need?
Well, I had a shopping bag of supplements.
I started with 44 units in the morning and 42 units at night, and now I'm 9 units in the morning and 9 units at night. I lost 47 pounds. Since I started, since I've been off more of my insulin, but anybody I would recommend Puro. I mean, it's a healthy way of life.
One for diabetes, one for cholesterol, one for blood pressure, and stomach medication.
For acid reflux.
For acid reflux, yeah.
So, and you're
For
off of all of them?
Yeah, all of them.
And we've also seen really good improvements in your blood levels.
Yeah.
So,
Usually it was 245 pounds. Right now it's 14.
yeah, you have
I
great
lost,
blood.
I made my goal, my A1C was 6.4, so I'm now down to 5.9. So my sugar is tremendously improved. I'm having less lightheadedness and feeling sick from having high blood sugar.
I saw results directly from the toxic. My body was so toxic from chemicals and things that were in my body that shouldn't have been. And once I was eliminating the toxins and following the diet programs, I felt good right away. This totally gave me my life back, and I'm just so thankful that I was able to do this program because it did work for me and it's effective. And if I can do it, anybody can go through it.
Where she's back to having lunch with friends and doing gardening and it really good for me. Plus, I have
I had gone to one of Dr. Sullivan's seminars, and I said, this is it. This is what I need